Okay.
You ready?
Greetings everyone, my name is Alexis. Thank you so much for visiting my channel. If you don't mind, please hit the subscribe button and the bell as well to make sure that you get notifications the next time that I upload a video. Today I'm going to be providing you all with the biggest tip that one can give a healthcare provider. Today I'm going to be talking about cultural considerations for healthcare practitioners that are providing services for Hmong individuals. Currently, many healthcare practitioners are not culturally competent enough to fully assist Hmong individuals. In order for healthcare practitioners to fully assist our clients, there are certain things that they must do. The very first thing that healthcare practitioners should consider is being culturally competent in order to demonstrate that they are trauma informed. To prevent yourself from re-traumatizing the client, healthcare practitioners need to fully understand all of the values and beliefs that come with an individual that identifies as Hmong. Healthcare practitioners may encounter Hmong individuals that present with several different barriers. The first barrier that may present includes language. The Hmong language is difficult to translate into English because English is based on the Western model. The language that Hmong population uses has limited terminologies that describe mental and medical illnesses, making it difficult for them to fully understand their diagnosis. The language that Hmong people use is very unique to their culture, and it has not been well documented. It began having a written language 50 years ago. Because of this barrier, there are not many translators that are able to communicate effectively with healthcare providers. That acts as another communication barrier for healthcare practitioners. In order to describe some medical terms, one has to paint several different pictures for the client to completely understand what it is that they are trying to convey. Other considerations that should be accounted for that act as barriers if not considered include stigmas that are associated with the Hmong culture. For example, many Hmong people do not believe that Western physicians will give them the appropriate care, believe that they are treated as guinea pigs or lab rats. Many fear seeking mental health treatment because of stigma associated with diagnosis. Mental health is a new concept within the Hmong community, and they consider it to be negative and taboo. Many believe that exhibits of a mental health diagnosis is more or less connected to their souls. To prevent yourself from re-traumatizing the client, healthcare practitioners need to fully understand all of the values and beliefs that come with an individual that identifies as Hmong. In order to address this issue, we need to increase awareness among healthcare providers and the Hmong population. Doing this will allow us to create organizational changes. When we create changes, we'll be able to assist the Hmong population holistically. After facing so much trauma during the Secret War, in a study in 1997, Nicholson identified that acculturation was a stressor that impacted the mental health status of these refugees. So the stigma and communication barriers further exacerbate their mental health issues. In 1988, Westermeyer found that many Hmong individuals suffered from chronic adjustment disorder and chronic acculturation syndrome. Other barriers that are presented within the healthcare field include physicians providing treatment options that are based on the Western medical model. Hmong individuals have different cultural beliefs and values that prohibit them from adhering to these different treatment plans. So to address this issue, the United States were so kind to allow eligible Hmong immigrants into our country to seek refuge. But research has proven that many Hmong individuals still refuse to seek medical treatment. To begin figuring out where should a healthcare practitioner begin creating these sustainable changes, I have the answer. The answer is in theory. The first theory that I think one should consider when trying to figure out what type of changes should be made is the trauma-informed theory. It's a relatively new theory, but it definitely will allow you to be a trauma-informed practitioner. The next theory that you should consider is the developmental theory. This theory will allow you to understand how trauma may impact an individual depending on their age and what stage they were in when they experienced the trauma. The next theory is the attachment theory. The attachment theory will allow you to understand how many Hmong Americans that struggle with separation or anxiety due to things associated with attachment in the past and the trauma that they have experienced. The polyvagal theory will explain why individuals may react the way that they react when in situations that remind them of a past traumatic situations. There are 3 different things that an individual may display when they are in those familiar situations. The first one is flight. An individual can decide to run from an issue. The next one is fight. An individual can decide to fight the issue. Or freeze. An individual can simply just stand still. That healthcare practitioners should consider the way that the Hmong population decides to process anything that could be considered as a health illness. Many Hmong individuals like to seek assistance from healers, such as shamans. The belief is that if you have lost your soul or if you have encountered other spirits, negative spirits, this could lead to different mental health symptoms such as depression, delusions, loss of appetite, nightmares, changes in behavior, and more. Many Hmong individuals believe that there is no medicine that will alleviate those symptoms. They believe that they have to go and see a shaman in order to understand why their soul has been lost. Another cultural consideration healthcare practitioners should consider is the health practices that Hmong individuals engage in. Many Hmong individuals find it difficult to understand scientific terms for medical challenges. This could be due to their lack of exposure, limited language, limited experience, and limited education regarding our health practices. In order to create changes that are beneficial for the Hmong population, all health practitioners, including physicians, nurses, psychologists, case managers, certified nursing assistants, pharmacists, counselors, etc. They all need to increase their awareness regarding Hmong cultural values and beliefs. These healthcare providers also need to make it their job to aim to increase health and mental health awareness among the Hmong population to address any stigma that they may have. To enforce healthcare providers being culturally competent, there are certain things that organizations can change in order. One thing that organizations can do to benefit the Hmong population is to hire multicultural and bilingual staff members that are from the community. This will allow them to connect with Hmong individuals using the same language that the client may have. Another thing that organizations can implement is educating clinical staff on ways that they can be culturally responsive. That organizations can create educational materials that are culturally and linguistically appropriate for this population to make them feel comfortable and welcomed in whatever setting they are in. Develop relationships with community leaders. The Hmong community operates off of a patriarch where the men lead the families. It would be helpful for healthcare practitioners to get involved with these community leaders in order to figure out how they can create wellness programs that actually benefit the community that they are intending to serve. They can also provide patient-centered care. But hey, we're all supposed to provide patient-centered care, aren't we?
Right.
Other things that healthcare practitioners need to consider in order to demonstrate cultural competency includes things that we should already be doing, such as ensuring safety throughout the organization. Individuals that have already experienced trauma do not need to be re-traumatized when entering your clinical setting. You also need to recognize that each person's situation is unique, and that means that they will need an individualized plan. It is also beneficial for organizations to offer peer support and self-help groups. This will allow the Hmong population to feel comfortable, not feel singled out, and have some type of support group that will help them get through whatever their health challenges may be. It is essential for all health practitioners to build on what strengths the client has to offer. And it's been nearly 50 years since Hmong individuals began their immigration to the United States. And today, healthcare practitioners still need to increase their understanding of cultural values and beliefs. Understanding cultural considerations for the Hmong population will be beneficial across all settings. The tools that I've provided you with today will allow you as healthcare professionals to better assist your clients that identify as Hmong. This will help you be able to build a positive patient-provider relationship, and it will also show your clients that they can trust you, and ultimately increasing the health of the Hmong population in the United States. I advise you all to research Hmong history and culture, provide health education for Hmong individuals in their familiar terms so that they can learn more about the Western medical model, address language barriers by providing interpreters or ESL services. You should also provide information that prevents stigma surrounding health and mental health services.